Hello. Clear? अच्छा ऐसे हेलो
उसको ऐसे ही रहने या तो और थोड़ा करिए अपनी हिजाब को चिन पे लेके चिन के करीब लेके आइए
हेलो
जी जी
दिस इज गुड
Assalamu alaikum, brothers. On my left hand side, Ya Khwan, can I please ask you to move towards my right, if you please? Sorry about that. We're going to invite the sisters to come over here. Jazakallah khair. Brothers on my left hand side, if you don't mind just moving.
लो लो a table Ali will sit over there
But there's nobody. Somebody can just take our chocolate.
no no Ali will come and sit over there and you are just someone to press the slides
I'm the person who will press the slides.
you don't want
I want to.
okay, go that side and sit
Take it back and come over here. You wanna
Ibrahim
press
can
the
sit
slides?
with the sit wow
He can do the slides.
he can just press
He
yeah
can do the
he
slides.
can do the slides yeah go Wilma, you go with Ali
You know how to do that, right?
you can ask you take a chair from there come and sit here go Nimari bag
From where do I take it?
from there get my bag on the table over there put my bag on the table
Shall we bring the table like in the middle? Or like it's okay there?
मुझे नहीं पता
मैं पूछूं?
हाँ अच्छा चले हाँ ये बराबर है
हाँ ठीक है.
सुनाई देता है Ms. Alu? Yeah, okay. Assalamu alaikum. Uh, Today we are going to be talking about the neurodivergent child, a special child. This is one of the topics that needs a lot of focus, a lot of attention, and not spoken that much. So thank you very much. I would like to say thank you to Sabina ji and the entire team, MNN, to have me over here present this topic. So what we are going to cover today is we will cover the basic conditions that we see. The agenda is to look at the red flags that usually are missed. What is it that the schools can do for us?
Because they can hear.
Okay, okay.
Close it.
What is it that the schools can do for us, the support system, and who should you reach out to, and some of the most important questions that you should not skip when you go to your provider. Yeah? Okay, so let's understand what conditions do we usually see. We see autism, ADHD, we see global developmental delay, which is considered as GDD, ID, intellectual disability, LD, learning difficulties. Autism, very known, very much spoken about over here. People do know about it. It is mainly because the government is doing quite a bit about it. So it's a neurological condition. It's an entire spectrum. It has loads of red flags, right from speech to eye contact to sensory issues. We will be discussing the exact red flags of autism on the next slide. Then we have ADHD, which is classified into two. You see the hyperactive disorder, and then you also see attention deficit disorder. Then there is global developmental delay, where you see delay in all the areas. It could be movement, it could be speech, it could be learning. You will see the delays right from the beginning. From the time a child starts to walk, you will see delay in milestones. That's global developmental delay. There is ID, intellectual disability. That is also delay. But when you will see an individual with intellectual disability, they will have the language. They will be talking. You usually do not see a speech delay. Where the difference is, you will see intelligibility of the speech is much lesser. So you would see an individual who is able to do things, but no matter how much you teach, is not able to learn. You will see a 16, 17-year-old talking like maybe an 8-year-old and not realizing it. But they have language. They are doing things. That's somewhere on the intellectual disability. It could be everything can have a comorbidity. You can have an ID with ADHD, you can have an LD with ASD, so there is comorbidity. Then you have the learning difficulties. Learning difficulty, we know reading difficulty, writing, math, dyslexia, dysgraphia. So those kind of things, you are in the mainstream, but you will need support. You may need an IEP there as well. And after a few years, you may not need an IEP. So let's focus and discuss mainly on the red flags that you see for autism. Speech, either delay or complete mutism. There is no speech. One thing to rule out over there would be, is there a medical reason for the speech to not develop? You rule that out. You know there is everything is okay inside. But still, there are no words. That is when you would go to an SLP. Sensory issues, I would like to highlight over there. Okay, so there are loads of sensory issues. There could be texture. So the child is not able to wear an outfit that has a tag behind, or different kinds of rough textures. Food textures. Then there would be sound and light. So that's another sensory issue. Too much of sound, too much of light, overstimulating can cause a meltdown or cause frustration. So sensory issues, when you see, you would see in the entire spectrum quite a bit. However, one thing to keep a note of would be that if it is hindering the performance, you would need to seek an occupational therapist who is certified or experienced in sensory integration disorder. Keep that in mind because you would see an OT, great, a pediatric OT, which is a great thing. However, if the sensory issues are too many, always ask, do you specialize in sensory integration disorders? And of course, then you are going to be looking into how the progress develops. So there's sensory. Then movement, again, hyperactivity, restlessness, stereotypical behaviors, repetition of behaviors, a child lining up the cars. But if the child is lining up the cars today and then after maybe 10 days, no problem. Sometimes he feels like lining up because it's blue cars. That's why. But if it is repeatedly happening, he's lining up the cars or repeating some kind of hand movement or spinning continuously, there is some kind of repetitive behaviors happening. These are in our language we also call stereotypical behaviors, or sometimes they would on an IP would see like stims. So it's a verbal stim. Child is going on repeating some words that they've heard maybe 7 hours ago. So we call that delayed echolalia. There could be immediate echolalia. I ask you, hi, what's your name? And the child says, hi, what's your name? Immediate echolalia. So it's repetition. That is your, and social interaction and communication. Big impairment in ASD and found across the spectrum. Ability to have a two-way conversation. The child has the speech, all good. The child has the language, very nice, pretty fluent also. Child has the vocabulary also. But the child does not have the ability to make a two-way conversation. This becomes, it's one of the most stark symptom or the red flag of ASD, because they will answer the questions that you have asked. What will happen is that they're not going to initiate a question unless it is a need. So the need for food or need for washroom is when they're going to be talking, otherwise they wouldn't talk. But that's not the way a two-way conversation occurs. I ask you something, you say something, you comment, you compliment, that kind of a thing. So that is your autism. When it comes to ADHD, there are so many diagnoses made. This is ADHD, that one is ADHD, he's also ADHD. So many. I mean, half of the people, if we go for diagnosis, will be in ADHD. So ADHD has the attention deficit hyperactive disorder, where you would see a child restless, completely restless, running around, and inattentive also. Be ADHD. ADD, the child can be passive or active. However, attention is extremely poor. You give them a task, they are not able to complete it without a reminder, because either the attention goes to what the other child is doing, or there was some sound over there, or probably nowadays like a game. So that would be ADD. Both coming under ADHD. Incessant talking is something that is seen mostly in ADHD, be it ADD, ADHD. You see that. Why? Because of impulsivity. There is so much to talk, there's so much to tell, that they are not able to wait for their turn. That is also something that becomes like a prerequisite for social interaction, right? We talk when it's our turn and we are able to listen to others also. It's a prerequisite for your social interaction. This does come under the issues of social interaction. However, you wouldn't say it's a real communication problem, but it is a social interaction issue, because people don't like if you're incessantly going on talking. So, and also sometimes it becomes like that what they're talking is only their interest. It doesn't matter if it is somebody else's interest or not. So these are some of the things that you would see. Following a multi-step instruction is difficult. It's a 10-year-old and you will see, okay, go put your bag, put that food in the microwave and just get me my water bottle. So the bag is put. The rest is lost. Oh, really? When did you say? Oh, you said, oh, okay, I'll go. So, sometimes these things happen when the child is fogged out. And we know children. He is not in his frame of mind. Repeatedly happening, it's attention deficit. So, being disorganized, we see so much of it, so many kids. Over the years, some strategies, some inputs, some techniques help them to self-regulate. ADHD is all about that. It is a condition which is called the new normal. So, all you need to do is teach how to self-regulate. They do wonders. So, what families can do, if you see red flags, you would reach out to either your family physician, I would say a developmental pediatrician, but if that appointment is difficult, then definitely reach out to your family physician to see if there is a problem. If you are seeing something, then please go there and ask, are they also seeing those things? Or what is it that you should watch out for? Those kind of things. Document behaviors. What I say is that this is not a very lengthy task. This is something that even your pediatrician will tell you. Because they are not going to first say, oh, there is an issue. They'll say, come after 15 days. What do you document? Two things. Frequency and duration. If there is an undesirable behavior, if there is a stereotypical behavior, it happened today, and then it happened after 8 days. That frequency doesn't matter. But it happened 14 times in a day. The frequency matters. If there is a tantrum, 30 minutes crying, 5-year-old child for whatever toy they wanted, you didn't buy it for them, it got over. After 5 days, everything is okay. For 5 days, nothing, no tantrum. It's normal. Children throw tantrums. But if the tantrum is happening at a drop of a hat, something you said you will make it, you did not do. You were going to go out, we did not go. Okay, now Papa was supposed to come at 7 o'clock, he came at 7:30, now we cannot watch a movie. So everything is a problem, and the tantrums, duration. You are clocking the frequency, but you are also clocking the duration. So 30 minutes, sometimes 45 minutes, sometimes 1 hour of tantrum. So these are things that you would document as a parent. It's a matter of documenting it over in a keep, mobile, or something like that. Seek an early intervention, of course. If you see lots of red flags, like there's no eye contact, your child used to hug you before, but now the child doesn't like being touched. The child would play with others, but now the child plays isolated. It's a parallel play. There is no engagement with anyone. Then you know that there is an issue. You don't have to be validated by someone. You may want to seek early intervention. Starting your intervention at a new place, this is something that comes from me. I'm in practice since 19 years. I would only say one thing. You know your child is not going to come back and tell you what happened. So, no matter what, go, sit there, see the session. We will come to the point where I'll tell you what kind of questions you can ask, but never leave the child alone. See for a few sessions until you build that trust, and then say, okay, today I'm not coming, but suddenly one of the days, just go in. Ibrahim. The school supports, yes, the schools over here, I would say they do quite a bit. And they have their limitations. They have limited resource. Educational assistants are limited. Their classroom sizes are small. So they have limitations. Having said that, let's look at what the schools can give. The schools give you a communications program. It is called as an extended communication or things like that, you know. So if your child is in a communications program, that means the school is definitely helping you with building the communication pieces in a classroom, which is very crucial because it is so important to build communication in a group. So they are doing that. What they are doing, that you need to ask. EA support usually shared over here, I would say, unless the child has profound issues, an educational assistant is shared across 3 or 4. And they manage all 3, 4 children. They have something called as life skills support room, or they call it even contained classrooms. You may have heard. In Peel region, I have heard, they call it contained classrooms. So contained classrooms are for about 5, 7 children, and then there are 3 or 4 EAs. So it's a ratio of 3:6 or something like that. They have an IEP, and they follow that IEP. However, I would say always look at what is being followed. Yeah, because IEPs are lengthy. It's a 3-4 page document that comes to you. So then you need to highlight what they are going to do this year, what they're going to do in this term. If you've highlighted that, then you know that this is what I need to go and ask. Because 15-minute meeting, what will you ask and what will they tell? And yeah, ask questions. What will be the transitioning process for my child into the mainstream classroom? What will be the transitioning process after the elementary school? So from elementary, suppose they put them in the contained classroom. So is that going to happen even in the middle school? From middle school, high school is, okay, I wouldn't touch that because that again becomes a very different pathway. There are different colleges and stuff for that. But from elementary to middle school, if there is a transitioning process into the mainstream classroom, those kind of questions. If there is an EA, and if an EA is the one who's working with your child on the communications program, then yeah, you have the right to at least ask, is she trained in that? You wouldn't want to ask too much on the qualification. The school takes the responsibility, and of course, you wouldn't want to get onto the wrong side. Or just say that, like, if she's doing PECS, stage 2, she's trained in doing PECS stage 2. So it's a very simple question, and you would want to obviously see when and where you're asking, not putting anyone off. Let's look at the AST funding process in Ontario. You get a diagnosis. You receive the diagnosis from a government certified psychologist. You've got that, you upload that on Access OAP. Once you do that, you wait. You wait. Then you qualify for the funding. Once you qualify, you are called for the dawn meeting, which is the determination of needs. What are the needs of the child? Depending on the complexity, you get the funding. Once you get the funding, you are able to seek services. Having said this, of course, there are many, many that we know, I know by now, who do not have funding. They still seek services because you can't be waiting for 4 or 5 years in the queue. You lose the early intervention time. So some of the questions to ask. So crucial, because I also see some parents who come, a few things you've told, they've agreed, good to go, all good to go, yeah, when can we start? What therapy do you recommend? Do you recommend SLP, OT, ABA, counseling, everything? No. So you recommend this and you don't recommend that. Why? The underlying why has to be there everywhere. So how can I take something from here? What is a home-based program? Why would I ask for home-based? So if I don't ask for home-based, then how do I generalize? How long am I going to keep coming and dropping my child over there to you and you doing work and like me paying? I need to generalize. If he's performing here, then can you please tell me what can I do at my end? And if it is possible, can you make some material? If it is not possible, no problem. Take a picture of the material, make it at home. But you're doing the same thing. Probably, if you've asked them for some videos, then you know how that material is utilized. Because one thing is what we do. The other very important thing is how we do. It is so common sense to say, let's reinforce the child. Yeah? Let's catch that right behavior. Let's make sure we don't use the word no. How then that you need A professional. Because everybody knows it, right? That's the science of behavior. That's the crux of it. So how it is done, how consistently it is done, what is done and what is not done. We are not prioritizing everything. We're prioritizing a few things. There are only 4 goals. We are only working on those 4. We are taking data only on that 4. We are coming to mastery and fluency only for those, and then let's look at something else. That is how we will teach. So it is the how you're going to do that. Because in a meeting, usually what you get is what. We will do this, we will do this, we are going to look at this, we are going to put the communication program, so we are going to put a token board, and we are going to make sure there is a routine, and after 5 tokens, he's going to get a reinforcement. Good, great. At that's not the time to ask how. After 1 month, how was that done? Can I get a video? You need to get a video. That's how you will come to know what happened inside. Supervision. So, ethically in Ontario, as per the College of Psychologists, supervision is 10%. The BCBA has to see 10%. If your child takes 10 hours, he's taken 5 sessions of 2 to 2 hours, after which she will see for 1 hour. Again, what was done, what was not done is documented. Ethically, it is documented. That is correct. They do that. How that other thing, what was not done, is going to be done? Who takes care of that? Because the BCBA has left. They are consultants. So, then what? In some cases, you may see them constantly looking into it. There are some, but there may not be. Your job is basically just to make sure that if she has left with these notes, this person is delivering it. Does this person understand? That is the only simple question. I am paying. And I am paying out of funding or out of pocket is not the concern. I am paying because this child needs to progress. So, that payment is for that child to progress. I really need to know what, why, how. School is free, so you can't be pushing that much. Providers can't be pushing. So, some of the times I have seen certain goals are not taken up. Certain technical language that is used is, we don't meet the prerequisite for this, so let's wait for 6 months. What is that prerequisite that you did not meet? So what is it that we can do from our side? And I can give you an example over here. I have one parent in Milton. I said, he doesn't meet the prerequisite. She doesn't know. She said, show me what is a prerequisite. मुझे नहीं समझ में आया what you said. Very clearly she said, I did not understand what you told me. I had to print out from the manual, and then I had to show her. We are at H11, you are asking me to do H20. Okay, these are the things. So she then sat down to say, okay, fine. These 6, 7 that we are not meeting, out of that 2 are not my concern, other 4 are a concern, nahi to he cannot do H20. So, can we start with these together? I will work with you. We made it. She worked with me. Every weekend passes. I go on Monday. I'm changing the prompts. I'm changing the prompts because he is learning it. Because she's working hard behind him. So, I'm just giving this as an example. If you want to be on top of someone, you can be. You don't have to be qualified for that. You can be on top of people. Because you want to see results. And it has to be result-oriented. No one is here for talks. So, yeah, I would just say ask almost anything that comes into your mind. Yeah. Some of the complementary supports that I have seen, like building a structure at home, building a routine, making sure the diet is good, making sure the sleep is good, making sure that too many changes are not happening because the routine gets disturbed, right? So don't make sure that those things don't happen. The gut health, homeopathy, I'm saying because I have seen many doing it, it works. And if it doesn't work, it doesn't damage any organs. Like just that much. That I have nothing to do with homeopathy. Some natural interventions, medical interventions, they work. Because that is our second brain. And if the gut is not okay, the child is not okay. They are irritable. So that's one area. And yeah, inclusion, support in the community, those things take us a long way. So if you have any questions, I'm open to that. Ji. What happened? Hello. It works.
Off this one, then the other can speak, otherwise it won't work.
Oh, okay.
Just no, turn it off and turn it on.
Thank you for your presentation.
Ji.
My question is, you are mostly talking about the kids, so what we should do in the beginning, in the school level. What if the school level, the kid is not taking care of those deficiencies like hyperactive or they are not attention deficit, etc. And the kid was gone up to high school and they passed the high school. Nobody diagnosed it since the day one. So now at this stage, the kid or what the adult is now diagnosed that she has attention syndrome or whatever else, and she has other things. How this system works? So my question is that how can a kid go through all these school stages and come to the college and now it's diagnosed as all these things? Thank you.
Yeah. What is happening is awareness is increasing. That's all is happening. There is someone who had mild issues, but today those mild issues are being spoken about. And because they are being spoken about, you seek professional help. And when you seek professional help, they run a checklist and they say, oh, it looks like mild ASD features. So that's okay. If that individual has successfully passed all the grades and come to that point, and today if there is a diagnosis also, it just tells the individual, okay, I have certain strengths and I have some limitations because of this. But I came so far, I can go beyond this. So it's awareness. Yes.
No, I just wanted to comment on the uncle's question because I was diagnosed at 46. So it is a very difficult process. I spoke to my doctor. Obviously, if it wasn't for COVID, I wouldn't have found out. But I spoke to my doctor in 21. I was diagnosed in 24. So it's a difficult process. I do have a question though.
Yeah.
I really
Sorry. Yeah.
I also really appreciate the information that you gave. It was very relevant and helpful. Can you go back a little bit and help us contextualize just generally how big of an issue it is? I know I've spoken to people that don't even think it's an issue at all. Just the stigma of it or some background on the issue generally. Non-clinically, I guess.
Non-clinical. So autism or ADHD has been stigmatized just like other neurological conditions. What happens then is that people don't discuss about it. So if you know that you have ASD or your child has ASD, but it doesn't show because the child is talking really well and all that, you don't talk about it, which is fine. It's a personal opinion. Generally speaking, and so because you're saying generally speaking in the community, so if I have to say the Islamic community, it does become a little bit like you don't want to talk about it, you don't want your relatives to know about it unless the signs are showing. Or if I have to say from the Indian or Pakistani diaspora, if diagnosis has happened over here, you don't have to tell everyone over there. For what? You don't need to. So this is a problem, generally speaking, that people don't want to talk about it. You spoke about it right now. That is because now at this age, you are what you are. You are successful, you're doing what you're doing. So how does it matter? Now it doesn't matter. But what matters is when your child is young and he has sensory issues, you don't want everyone to be asking questions. You're already dealing with enough, and that enough is really enough. It's just that people don't want to talk about it more openly. Yeah.
So actually, the thing is like masjid inclusion. So inclusive environment should be the first thing. Like I have an ASD kid who was severe, but from where I have been thrown out mostly was mosque. Even during Taraweeh, they made me sit in the store with my son. So the masjid inclusion was the first thing that needs to be added. But our religion is teaching us. Even my second child, he's just impulsive because he's been born and brought up with the ASD child and he's impulsive. He's been thrown out of the religion class because he was not sitting properly. And no doctor is ready to diagnose my second child. So I think so inclusive environment, and this presentation even should have it at the end how people should be treating us, because religion, like our religion, teach us kindness, being gentle, and we can easily tell which kid needs help, which family needs help. So that's what it was, not mostly a question, but inclusive environment. We are the people who can bring more inclusive spaces. And masjid, like it's the most park space for us. So how can we not change our thoughts for especially those families, like my family or the other families? So that's why I would request you even to add the inclusion as a first point that will change whole family's perspective. Even like Deen Islam don't brings this kind of thing. So that's what. Thank you.
I mean, I totally agree to what you say, that the masjid is a place where inclusion should happen. I would only say that we need to be more persuasive in this area. That's all I can say. Walaikum salam.
Hello. Yeah. So I also wanted to say that with the inclusion, also acceptance when we go to the mall, and like a child is not behaving what they say, but he's having sensory issues or meltdown. So how to show acceptance? Okay, this is a child who has additional needs. So maybe like doing more programs like this, but showing how we can accept these families and with like kids with autism in all the spaces. That can be mall, that can be movies, that can be especially mosque, everywhere. So I think whenever you do the program next, if you can just share, like, tell other people too, and maybe like in Friday khutbah, then how to help these families and like how these families can be more accepted.
Assalamualaikum. I just wanted to add as well, kind of work that I do. I work in family medicine as a nurse practitioner. And I do a lot of well baby visits. And I think it's really, really important, especially between 12 and 18 months. That's often when we see the signs.
Yeah.
Right? Whether it be the speech, the social, the speech, the social, like that's often where, like I've been doing this for 18 years and I see it time and again, right? So it's really about using those opportunities because there's 12 months, there's 15 months, there's 18 months, and you can also come as many times before, between, or after, right? And especially before school starts.
Yeah.
So you have these there's opportunities where we can work with your family practitioner. We can access the resources. There's certain resources which are government funded, especially between 0 and 6 years.
Yes.
Right? That is the critical time, but often people get really afraid, right? And when they're afraid, then they don't act. They're in denial, and then they miss a huge opportunity. And then another thing that we see is, like the brother was saying, is university, college age. Is we see that's another time when we see that, you know, we're seeing something isn't, they're not coping well. But I've had patients as well who have done testing in the high school years because they knew that something wasn't quite right. They did psychological assessments, psych-ed assessments, and that helped advocate for them in the college and the university years so that they could have accommodations such as, you know, extensions, if they need a separate dorm accommodations and other things. And the university, ASD and autism and ADHD, there is provisions, right, as a disability when they're studying and beyond. So.
Sister Arwa, as you know, our MPP, Mr. Sabavi, is here, and he can take some questions on behalf of our provincial level, because health and education both comes under provincial. Thank you, Mr. Sabavi, for coming. You can ask questions, sisters, if you have any questions.
This one.
Can you take it from your pocket?
Assalamu alaikum. My name is Sheikh Sabawi. I'm the MPP for this riding, and I'm active in the community as well many years before that. So I just want to thank you very much for the presentation. The recognition of the ADHD and autism have gone folds ahead in the last few years. We are learning about things like I was an overactive child, and I have been having troubles in my school all the time because I can't sit aside, like I can't sit for more than 10 minutes. And that's have been like troubles for me all the time. But it's recognition of things, and now not only doctors understand it, but teachers understanding, people understand it, parents understanding, and that's the importance of raising awareness about the detection, because early detection is the main goal. The very big success in the 0 to 6 years to try to get as much possible to the kid in behavioral teachings and disciplinary and stuff that make life change for that kid. So this is the importance of those sessions, is to help people to understand sometimes behavior they don't understand. They think that the kid is just not obeying things, not complying to or instructions, but the fact is he can't. Like, that's his nature. So this is what we have been doing through government as well, to try to make sure that, for example, the embedding the special kids into the classes, because the inclusion, the fact that they are inside the class, regular class with other students, not only helping them to get used to be in the crowd and in front of the people and with people, standard people, but also for those people to understand that nature. They seen those kids with them in the school, so they are aware and they understand how sometimes to deal with them. So this is two ways learning. Two ways learning, not only for the kids who have the spectrum, but also the rest of the class. Um, One of the items I always talk about is when we came to in 2018, there was only 8,000 kids of the 32,000 registered cases in Ontario receiving the government aid. And we changed that. I'm not sure now how many covered, but we kept adding, doubling the funding, tripling the funding, quadruple the funding to make sure that everybody get some help. Also, there was only 6 providers approved, registered providers across Ontario. You can't get the funding except through only 6 providers across the whole province. And that caused troubles in the waiting time and also in how they spend the money. Now the money flows to the parents, and the parents actually have control over what they want to direct their funding to, so that they know the kids. And let's be frank, the main caregiver for those kids are their parents. They are the one have the patient. They are the one have the interest. They are the one have the time. They have the exposure to give as much as possible of time and attention to those kids. So this is why we also allowed any of the parents who have kids with some sort of ADHD or autism or whatever, they can actually do the study and the diploma for free. The government pay for that. So not only that they will understand how to deal with their kids, they actually can get professional in that and serve other people in the community, because they understand the case more than anybody else, because they live it. So they can be a best providers to other kids as well. So other items, the inclusion point, I totally agree with you, but again, we don't want to say that the communities weren't responsive, the communities weren't aware. It's a learning curve. I thank you very much for the presentation, because we need to make sure that people knows and that removing that stigma of mental health and special needs like autism and ADHD. It's important because you can meet somebody who have some ADHD and you will never know until something trigger that. Then all of a sudden he becomes so angry or becomes so upset. So if you know, you're already not this person, but you know generally, then you can read the signs and say, that's it, we don't want to push more than that, because I think he get to the limit. This is important, because you can't blame him if he already crossed his border. He have no control over their actions. So you have to be very careful with that. But if you are not aware, you can't be that. So the awareness is a very important thing. I think I covered majority of the points I picked during the presentation, but
I have few questions here from sisters. Mr. Sabavi, can we start?
So I have 2 kids. So like you said, ADHD. So from last 2 years, I was trying to get my second one get diagnosed for ADHD. But how family pay that much to get him diagnosed? Even to get him diagnosed, if I'm okay to pay, still I have to wait in the waiting line and waiting list. Like for ADHD. And when I am telling the teachers, you are saying teachers are well educated. I am from that country where me and my husband were teachers. We used to deal with 50-50 kids and who used to be hyperactive. Pakistani kids are, in every household there is an impulsive kid. I don't know. Here they have 26 kids and they are calling you every day telling that the kid is getting triggered. It means he is getting triggered if he is having issues. If he is not having issues, so the first thing that I noticed is teachers, I don't think so. Even they are like Ontario teaching certification and everything, that's how they are dealing. That's how they are telling the parents to get. then if you are not going to get funding, like my son who has ASD, he's 9 and now he get the funding.
Yes. Yeah, I know I have few cases in the office. We need continue working. We try to keep pushing, but it's up.
Can you help this family in any way?
We can continue pushing if they're already receiving the funding. That's it. I mean, there's nothing we can do. Yeah, we can push for the second child. Absolutely.
Thank you. Next question.
So I can support him because other than me, no one can support him. I have to go drive him to therapies. I have to go take him to all the appointments by myself. And he's
So,
toilet trained, but he has
till now he didn't get yet the
no. There's no
assessment.
funding, no kind of funding for the SSAH. Waiting for so long.
Okay, send to our office. I'll try to push that.
Can you take two more
Usually
questions?
mothers take lots of load in that. I know the.
Yes, that's absolutely true. Brothers, please.
I hear you.
All right. Looks like I'm back anyway. No, I actually just wanted to. Alhamdulillah, I think I got very lucky because my child's condition was not. It was ADHD, and he got. We identified it when he was in grade 4, and he was officially diagnosed when he was in grade 5, and they put him in the queue for the psychoeducational assessment. Didn't happen until grade 10. So there is a problem with the way that delays our systems and the resources are available. He's much older now. He's on medication. Alhamdulillah, he's figured out a lot of techniques, and we've worked with him. So he's on the right track. And inshallah, alhamdulillah, he just got into TMU. He'll be starting next year, inshallah. But generally speaking, I'm sure a lot of parents are doing, and just because my child's issue was relatively easier for me to handle, and I had experience from my own self as well, for parents with children with autism or severe conditions, I'm sure it's way more worse. And if you can have generally any impact on the process of how things are.
We are like it's a dynamic process. We keep trying all the time to add more funding, to add more money into the issue, to make sure that there's some resources to help, government resources and external resources, and encouraging more people to get certified so that we have variety of the service, like options, not only one or two or like 5, 10, 15, so that the more options, the better serving to the community, depending on the case, depending on the situation, depending on the location, depending on community, language barriers. There's many things. So we keep encouraging people to get certified because that will serve themselves, their kids, and the community around them. To your point, again, I understand it's a learning process. We are getting better and better and better in understanding and early detection, in trying to put the procedures, improving the matrices to gain more understanding about the cases, to deal with different cases in different ways depending on the situation, as she mentioned. But there's always room for improvement. I'm not saying that it's bulletproof, but we gone long way. Long way. Yes.
Thank you very much.
Okay. I will take the two questions. I will take the two. I'll take the two. The yeah, but there is certified people who can take care the kids who have special needs, autism, special, and ADHD. Like the case in my office came. She is a teacher and she had two kids, and she basically was being like saying that my salary wasn't enough to cover for the cost of getting professional for both. So she went for, I think it's a year, either a year or 2 years, and she gets certified. So she's now taking care of two kids and having 6 kids as paid care. So she's making money. No. Sorry?
You have it?
I'll have. She might know better than me. I'm not the professional in that, but. Okay, can you? I would like myself to know. Tell her, and I would like.
Oh, okay.
I'll take it. Let's finish this question first.
Okay. So there is a registered behavior technician course. It's called the RBT course, which is mainly for autism and ADHD. And you should be able to do that course in 6 months or 1 year. It depends. It's self-paced, so you can do it fast track. You can do it across 1 year. You can do it online at Conestoga. You can do it at Brown's. You can do it like George Brown. The registered behavior technician course. So you can do these. Check at George Brown. I don't think so. It is free over there, but there are institutes providing these courses, because I know people who are doing it in the field. But how you can get it free at which places, that you may want to find out. But definitely, yes, there is a provision for doing that course.
Yes, it's free for any parents who had kids with condition. The government pay for it. Yes. Yes. Yes.
Is there any government funding that can support us as lay people, as volunteers, so that we can enhance our programming to be more inclusive? Because right now we need help.
For the specific like funding for this, no. But there's many funds you can apply for if you have a program. There's Ontario Trillium Foundation have grants. So if you have a program, you can apply and get some money from the OTF. There is some other grants for the family and children ministry. You might be able to. But again, it's an organization-based, not community-based. So some organization have to fill the application, apply. I think if it's non-for-profit organization can do. Any non-for-profit organization can apply for that. Not like, of course, if that's their business, they can't apply for the grant. But if not-for-profit, any not-for-profit organization are relevant can apply for things like that. So you have to build the program and apply. Again, it's there's different matrices for different grants. We don't interfere with that, so don't expect the government to be the yeah or nah thing. There is matrix, the bureaucrats who can do that. So it's arm's length. Like, we don't have control over that. Just to clarify, because people think sometimes when they apply that we have the ability to say yes, this application take money. No, we don't. So thank you.
Thank you, Mr.
Thank
Sababi,
you.
for answering all the questions. And we are going to close the session. Sister Arwa, do you have any final comments, please?